Hey everyone, welcome back to the channel. Today, we're exploring an incredibly important issue at the intersection of health and the environment: vector-borne diseases and their alarming connection to climate change. Whether you're a health professional, a researcher, or someone curious about how the changing climate affects public health, this video is for you. Let's dive in. So, what exactly are vector-borne diseases? These are illnesses caused by pathogens and parasites transmitted to humans through vectors like mosquitoes, ticks, and fleas. Some of the most well-known vector-borne diseases include malaria, dengue fever, Lyme disease, and Zika virus. These diseases are already a major public health concern, particularly in tropical and subtropical regions, but as the climate changes, the situation is becoming more complex and more dangerous. Climate change is having a profound impact on the spread and intensity of vector-borne diseases. Here's how it works. As global temperatures rise and we see changes in rainfall patterns and humidity, these factors create the perfect conditions for vectors like mosquitoes and ticks to thrive in new areas. For example, mosquitoes that carry diseases like malaria and dengue are moving into regions that were once too cold for them to survive, including higher altitudes and temperate climates. This means diseases we once thought of as tropical are now spreading to places like Europe and North America. Climate change is also extending the transmission season for many vector-borne diseases. Warmer temperatures mean that mosquitoes and other vectors are active for longer periods each year, increasing the chances of disease transmission. We're already seeing this in action. Over the past decade, there have been major outbreaks of dengue fever, Zika, and chikungunya in areas that have historically not experienced these diseases. And many experts warn that if we don't act, these outbreaks will only become more frequent. The health impacts of vector-borne diseases are devastating. Malaria alone kills over 400,000 people annually, most of them children under 5. Dengue fever causes severe flu-like illness and can be fatal in its severe form. Lyme disease, spread by ticks, can lead to chronic health problems like arthritis, neurological issues, and heart conditions if left untreated. As the situation evolves, health research must adapt to this new frontier. Climate change isn't just an environmental issue, it's a public health crisis, and vector-borne diseases are at the center of this growing challenge. There are 3 key areas where more research is urgently needed. First, we need better predictive models to understand how changing climate patterns will affect vector behavior and disease transmission. By incorporating real-time climate data into public health surveillance systems, we can anticipate and prepare for disease outbreaks before they happen. Second, more investment is needed in the development of vaccines and treatments for diseases like dengue, Zika, and malaria. While we've made great progress, there's still a lot of work to be done, especially as diseases spread to new populations. Finally, health systems need to become more climate resilient. This means building infrastructure, particularly in low and middle-income countries, that can withstand the increased burden of climate-related diseases while ensuring access to prevention and treatment. On a personal level, there are steps we can take to protect ourselves from vector-borne diseases. Using insect repellents, sleeping under mosquito nets, and supporting vector control programs in your community are all effective ways to reduce the risk of infection. But on a larger scale, addressing the root cause climate change is critical. This means supporting policies and initiatives that aim to reduce greenhouse gas emissions and investing in clean energy solutions. Public health and climate policy must go hand in hand to tackle this growing threat. Vector-borne diseases and climate change are interconnected in ways that make this issue one of the most pressing health challenges of our time. We need more research, stronger health systems, and coordinated global action to protect communities at risk. If you're a researcher, health professional, or someone concerned about climate change, now is the time to get involved. Thanks for watching.